Good evening, I'm Deborah Pinkerton. Tonight on Family Matters, Women's Health, we're talking about important conversations every woman should feel empowered to have about her health, her future, and her family. From family planning and preventative women's health to high-risk pregnancy care and pediatric cardiology, we're taking a closer look at how compassionate, coordinated care can make all the difference for moms, babies, and families. Tonight, you'll hear how specialists across Penn State Health and Penn State Health Golisano Children's Hospital work together to support women through every stage of life, including complex pregnancies and advanced pediatric care before a baby is even born. We'll also introduce you to a remarkable family whose journey highlights the power of collaboration, trust, and hope. And if you have questions tonight, Donna Kirker-Morgan is here to tell you how to get them answered. Hi, Donna.
Hi, Deborah. Throughout tonight's program, women's health experts from Penn State Health are answering your questions during our live web chat. Topics include pregnancy, postpartum health, screenings, and more. Dr. Raliat Bashua, obstetrician gynecologist at Penn State Health Hampton Medical Center, is answering your questions in a live web chat until 8 o'clock. To submit a question, go to abc27.com/women's, and I'll be back later in the show to share some of the questions that are coming into the good doctor. Back to you, Deborah.
And thank you, Donna. Joining us is Dr. Vanessa McDonald, obstetrician and gynecologist at Penn State Health Lancaster Medical Center. Thank you for being with us.
Thank you
For women who are thinking about starting or growing their families, what are some of the first conversations they should really have with their OB-GYN?
Yeah, so I think the two biggest things would be getting a thorough family history as well as a medical history. And I think with those two aspects, we can learn a tremendous amount, including any factors that we think may have a genetic component or may cause a problem genetically, in addition to learning about any medications or supplements the patient may be on that may cause an issue during pregnancy, and even all the way to figuring out when they are interested in starting a pregnancy. And I also like to give patients a gauge of how long it may take even to get pregnant, so they also have that expectation.
So this initial conversation is pretty important.
Absolutely.
And family planning really does look different for everyone. So how does your team really help women navigate everything from, say, pre-pregnancy wellness to fertility concerns and also pregnancy care?
Yeah, I think understanding first that it does encompass a lot. And so we start all of the way even before a patient even is pregnant. We offer preconception counseling and preconception visits to identify some of the issues I mentioned earlier. Once a patient actually tries to get pregnant and encounters some fertility issues based on their age, and how long they've been trying, then we would recommend bringing in one of our specialists, our reproductive endocrinology and infertility specialists. And then once they do get pregnant, we can also offer prenatal care. And if there are any high-risk issues, then we also have our specialists in maternal fetal medicine who can also help with those as well.
Yeah, someone there every step of the way.
Definitely, it takes a team.
It does take a team. So what is one of the most important things that women should do as far as feeling heard and supported?
Yeah, I think the biggest thing is to be able to find a team that's going to speak to that. And so I think our team in general, we try to listen to patients' concerns, answer any questions they may have, and also make them feel that they are part of their care at every step of the way. I think that really matters.
Yeah, it's so important to have a good relationship
Absolutely.
with your doctor. So Penn State Health Lancaster Medical Center continues to expand. Beautiful
Definitely.
facility. Let's talk about the care available there and really what it means for families living in Lancaster County.
I think there's tremendous things going on right now in Lancaster with respect to women's health. I'm really excited. Currently, we have recently opened a new location not far from the hospital, Lime Spring.
I've been there. It's nice.
It's beautiful. And so at both locations, we offer full scope obstetrics and GYN care. We're also been very fortunate at our Lime Spring location that we now have one day every week, we'll have a different subspecialist. So we have patients that can be seen by reproductive endocrinology and infertility, in addition to family planning, and also our high-risk specialists in maternal fetal medicine.
Yeah, that's great. So every woman's journey is different. So really, how does your team personalize care through all these different stages?
Yeah, so I think the biggest thing is finding out what's most important to the patient. You really have to listen to their concerns, what they're interested in the most, and what they want to get out of their care.
Dr. McDonald, thank you for joining us. We will be talking with you a little bit later in the show. And if you would like more information, you can scan the QR right there on your screen. That is for Penn State Health Obstetrics and Gynecology. Now let's check in with Donna Kirker-Morgan. What are some of the questions being asked tonight, Donna?
Thanks, Deborah. We have a wide range of questions coming into the web chat. Dr. Bashua, obstetrician gynecologist at Penn State Health Hampton Medical Center, has been very busy, and thank you so much for joining us. I know you have a little bit of laryngitis and you're still helping us out with these questions that our viewers are sending in. Our first question is, what screenings or annual women's health appointments should women make sure they don't miss?
Thanks, Deborah. Many women think they only need to come into the obstetrician and gynecologist when they have a problem, but really we do a lot more than that. We want women to start having conversations about their health. So important screenings can include pap smears, mammograms, blood pressure checks, screenings for infection, HPV screening as well, amongst many others, depending on your age.
But some women are hesitant to come in because it's, you know, it's a process to get undressed, but you're saying something is available now.
Absolutely. So women don't know this, but you don't need to get undressed at your annual visits. An annual visit is personalized. We just want to see you and have conversations about your health. And with you and I together, we can decide if we need to do a pelvic exam or not. Penn State Health is actually rolling out HPV screening that you can self-swab.
Oh my gosh.
So you can do this either, you know, in the comfort of your own home eventually, or we'll leave the room for you in your closed cubicle and you do the screening.
That's a great innovation. Now this viewer is asking, I've been trying to get pregnant for over a year. At what point should someone talk to their doctor about fertility concerns?
If you're over 35 years old and you've been trying for pregnancy for about more than 6 months, please come in and see the gynecologist and obstetrician. And if you're under 35, you've been trying for about a year, then we'd like to see you. If you have other conditions that make you more predisposed to maybe having problems, you have irregular periods, endometriosis, or your male partner may have some problems, then we want to see you much sooner. But at any time, just come in and have a conversation with us.
So important just to talk to your doctor. Now, if you have any questions for Dr. Bashua, go to abc27.com/women's and submit your question. Stay with us. Family Matters, Women's Health returns right after the break.
You're watching Family Matters, Women's Health on ABC 27, sponsored by Penn State Health.
Welcome back. A high-risk pregnancy often means specialists that need to be involved at Penn State Health, Golisano Children's Hospital. Maternal fetal medicine and complex fetal care teams work together to ensure a seamless, supportive experience for moms and babies. Alicia Shipkowski shares her very interesting journey. Alicia, you had 4 children that went to Penn State Health. When you look at them today, what do you remember? What do you recall? And you've gone through so much to overcome. What's all that involved when it comes to emotions?
When it comes to emotions, I mean, honestly, it's a lot of ups and downs. With my first, I was just so excited. We were becoming parents and it was wonderful. And we knew we had the history on my husband's side with congenital heart defects, and we found out that she was good and in the clear. And then everything changed with my second, Lily Mae. We found out at like 20 weeks that something was wrong, and it was hard, just constant ups and downs, and it felt like there were more lows than there were highs. And then after everything was said and done, all of her procedures, we know it's still a lifetime thing for her to follow and hopefully continue to follow with Penn State Health. But we know that we're on the up and up for her right now. And then we had our third, Gabrielle, and she had some things, but fortunately her condition, she was able to, I don't want to say grow out of it, but it just took her body a little longer to heal. And then we have my youngest, Madeline, who is now post heart cath and is doing really well.
Let's go back to the first time you were told that your babies could have congenital heart challenges. What was that like as a mom?
Honestly, it was gut-wrenching. It was one of those things where when you go to those anatomy scans, you're just praying that everything's perfect, that they find nothing wrong. And maybe you find out if you're having a boy or a girl and it's supposed to be a happy time. And unfortunately, with my second and my fourth, it was definitely not a happy time. It was finding out that we're going to have, at least from our side as parents, a lifelong battle of watching and just keeping an eye on them. So we were learning a whole new world of really the hard things that I would have never known otherwise.
You never wanted to get involved with, but you have spoken so highly of Dr. Pauli and her teams, the maternal fetal medicine, complex fetal care, and pediatric cardiology. What made you feel so supported during your pregnancies and also in your deliveries?
So with my pregnancies, it was wonderful knowing that I had a separate team when it came to maternal fetal medicine, and then as well as with the complex fetal care program that Penn State Health has. It was so in-depth. They were on top of things. They have their separate schedulers to make sure you don't get fallen through the cracks. But Dr. Pauli was just absolutely wonderful. If I had questions, I knew I could reach out and she would be able to answer them for me. And then when it came to delivery, because we knew about my children's heart defects, I knew going into each delivery that there were going to be a ton of people there, but there was a team for me and there was a team for the baby, and it was going to be okay and not to worry about the commotion.
When you do have a baby that's going to be delivered and thrown into surgery right away and then into the NICU, how do you as a mom push down the fears of the unknown?
What was great with the different doctors, like Dr. Breinholt, he didn't just give us like an overview. He took the time to go into every possible scenario that could happen and did a step-by-step of this is what, your daughter has, this is what needs to happen, this is what we're going to do if X, Y, and Z occurs, but was always so reassuring and allowed you as a parent to just kind of breathe. I think one of the greatest things was when Lily Mae was in the NICU, there was a nurse and things weren't going right. And I was like, it's okay. Just kind of to suppress it. And she said, no, it's not okay. And it's okay that it's not okay. But we're going to work on this and we're going to figure it out. And that's something that stuck with me now. She just turned 7, actually. So it has stuck with me for the past 7 years that even when things aren't okay, it's all right. We'll figure it out.
Oh, that's incredible. So for any other mom that's hearing this story right now and they've got children that have issues like this, what do you tell them about the entire team at Penn State Health, Golisano's Children's Hospital?
I would definitely tell them that if they're not already being there, that they really should reach out for second opinions. You're open to so many different things because they're specializing in maternal fetal medicine and complex fetal care when it comes to, genetic counseling and genetic testing, whether it's before or after they're here, as well as, just knowing that you're going to have the best care. They have, a level 4 NICU that, is second to none. And I'm so grateful for all of the nurses and PAs and respiratory therapists and any other specialty that either of my children saw during their stays there or in the PICU, because, they're on top of it, right? There was never a moment where we felt like we were in the dark. We were informed and always knowing what was going on.
Thank you so much, Alicia, for sharing your story.
Thank you.
And as you can see, Alicia and her family are doing very well. They're grateful for the care they received from everyone at Penn State Health. Back to you, Deborah.
Thank you, Donna. Joining me right now, Dr. Jaimey Pauli, Chief of Maternal Fetal Medicine at Penn State Health, and Dr. John Breinholt, Chief of Pediatric Cardiology at Penn State Health Golisano Children's Hospital. Thanks for being here, both of you. Dr. Pauli, you know, this was an amazing journey for this family. What does it mean to be there, walk alongside them every step of the way?
So, I mean, it's very special. We go into medicine because we want to take care of patients, and unfortunately some patients need a little bit of extra care, and it is a privilege to be able to take care of them from the beginning of pregnancy all the way through delivery, and to help them kind of get through all of the surprises and good ones and not that they have during pregnancy.
Yeah, well, they certainly very happy with the outcomes that they've had at Penn State Health. Dr. Breinholt, you got involved with this case because you found out about a congenital defect before the baby was even born, which is just amazing. How important is that early collaboration between maternal fetal medicine and pediatric cardiology?
You know, it really is essential. It's really become one of the hallmarks of our field, where we partner with our maternal fetal medicine colleagues. They identify that there's a problem. We're actually part of the Complex Fetal Care Center, so we work hand in hand with them. I have fetal cardiologists who work with them. They work together, they follow these children through the pregnancy, and then we're ready when they're born to be able to deal with whatever eventuality, whatever situation they might have to manage.
It is really just wonderful how far medicine has come, that you are able to see if there's an issue at hand. Dr. Pauli, when a pregnancy is considered high risk, how does maternal fetal medicine help coordinate care with pediatric specialists, NICU teams, and other experts?
So we usually think of ourselves as sort of the gatekeeper, or sometimes the train conductor. So the patient comes to us, we identify potentially an issue, or there's an issue that we confirm when they come to us, and then maternal fetal medicine, and my role in the Complex Fetal Care Center, is to help that patient get to all of the specialists that they need to meet before the baby's born, so the pediatric cardiologists or the surgeons or whichever teams that they need to meet, so that they can get as much information about what to expect when the baby is born and after the baby is born. And so I think we kind of hold everybody together, and we're sort of the bridge between pediatrics and obstetrics.
And everything is under one roof, so which makes it so wonderful. Dr. Breinholt, how important is it for families to have access to advanced pediatric heart care and also at a level 4 NICU unit?
Well, it's certainly very important. When we know that a child is going to have certain types of heart disease, we need to be prepared to act. And so they need to be able to be housed in a place like a neonatal intensive care unit, where they can handle any level of severity. And also that we have a team prepared to be able to act, whether it be a surgical intervention, a catheter-based intervention, or just the management to get them through that early time.
I know, Dr. Pauli, families feel comforted to know that people are there, ready to support them through this journey.
So I think that one thing that we do really well is that we have a really great coordinated plan. And babies come when babies want to come, and so we are ready at the drop of a hat, whether it's a surprise or not. Our team has drilled, has practiced, has made plans, has everything kind of set so that when the baby does come, the best outcome can occur, because we are absolutely ready with all the people there that the baby and the mom need.
It's very reassuring. Dr. Breinholt, what type of reassurance can you give parents who are watching this evening, so when they step into Penn State Health Golisano Children's Hospital, they know that they are going to get the best care possible?
Well, we're really prepared to take care of them through this entire journey. You know, once Dr. Pauli's team gets the baby to us and we're following along through the pregnancy, we can take care of them from the time that they're born. We'll take care of them throughout their entire life. And we have colleagues in the adult congenital heart field, which are adult cardiologists who are trained to deal with adults who were born with heart disease. So they really can take care of them from the time before they were born all the way through their entire life, and we're prepared to walk along that journey with them.
Yeah. Comforting news for parents. Dr. Breinholt, thank you for being with us. Dr. Pauli, you're going to be joining us again very shortly. For more information, or if you would like to make an appointment with Penn State Health Obstetrics and Gynecology, scan the QR code right there on your screen. Now let's check in with Donna Kirker-Morgan and get some more answers to our web chat questions. Donna.
Thanks, Deborah. Back with us is Dr. Bashua, obstetrician gynecologist at Penn State Health Hampton Medical Center. And we're going to start with this viewer question. Doctor, this person is asking that they had recently had a baby and they're struggling emotionally more than they expected. How do you know when it's time to reach out for help, or is this just normal mommy blues?
So a lot of women expect to always feel happy after having a baby or having delivery, but actually reality is that a lot of women experience emotional ups and downs. This is very common. If your feelings of sadness, anxiety, feeling overwhelmed, irritability, or difficulty bonding with your baby persist more than a few weeks or start interfering with daily life, then it's a time to reach out for help, okay?
And there's no shame in that.
There is no shame in it. This is not a personal failure. They're medical conditions.
Now this viewer is asking, I have a family history of heart problems. Should I talk to my OB-GYN before getting pregnant?
Absolutely. Yeah. Pregnancy can put a strain on your heart and circulatory system. So it's important that we know about this because it can affect how we monitor you and the baby through the pregnancy.
Very good. Thank you so much. I know you're still answering questions.
Yes.
You'll be here until 8 o'clock. So get those questions in to abc27.com/women's and submit those questions. Back to you, Deborah.
And thank you, Donna. Joining me again, Dr. Jaimey Pauli and Dr. Vanessa McDonald. Dr. Pauli, women are often taking care of everyone else but themselves. Why is it so important to take care of yourself?
So I tell my patients that they're the only person who can carry that baby and keep that baby safe while they are growing. And so the best way to take care of a baby when you're pregnant is to take care of yourself. And I think that that's something that moms who are willing to sacrifice anything for their children, we have to remind them that they are just as important. And so I'm always advocating for them to make sure that they are staying healthy, taking care of themselves, and talking to us when they are not feeling well.
And that's great, and you're there to help them. Mm-hmm. And Dr. McDonald, talk to us about the different tests that women should have and something that they should not ignore, that they should not put off.
So I think probably the two biggest ones are pap smear screening as a screening tool for cervical cancer, as well as mammograms for breast cancer screening, because we know that both of those conditions are actually probably a big area in women's health where initially patients may not have any signs or symptoms. And so getting regular screening with those can really be life-saving.
And this is all preventative care. And how often should you have these done?
So typically for the mammogram, we recommend every 1 to 2 years. And then also for the cervical exam screening with the pap smear from ages 21 to 30, every 3 years. When you turn 30, we typically add HPV testing. And so if both of those are negative, both the HPV and the pap smear, then you can actually go out to every 5 years.
Yeah, but it's so important to do these and
Absolutely.
to take time for yourself.
Definitely.
Dr. Pauli, let's talk about some of the warning signs that you may say, hey, this isn't something that I haven't been experiencing, but I am right now. Should I do something about it?
So I think patients and their families often think that symptoms that could be worrisome are just pregnancy related or just part of being postpartum and just having had a baby. That being said, there are a lot of things that are not normal and that really need to be immediately addressed. So when patients have really bad headaches or high blood pressure, any kinds of chest pain, swelling that they weren't expecting, bleeding that they weren't expecting, really almost, I encourage my patients to basically call, if they have any concerns whatsoever, call and talk to us. Let us make sure that this is truly normal versus not, and so that we can actually get them in and be seen. There's a lot of things that we can do and a lot of problems that we can prevent by getting patients actually evaluated.
And there's always someone on call.
Always, 24/7, 365.
That is great. Dr. McDonald, what message would you have for women, for our viewers this evening, as far as advocating for themselves?
So I think to know that one of the most important parts about you is your health. And so it's so important to, one, make sure that you're asking the questions, getting the questions answered that you are looking for. And if you don't feel like the provider that you're seeing at that time is doing that and addressing what's of most concern for you, then really seek out and try to find somebody who will, because we're out there.
Yeah, that's wonderful advice. Thank you both for being here this evening.
Thank you.
Thank you.
And we send a special thanks to Alicia for sharing her story, and you, our viewers, for sending in your questions. For more information, or if you would like to make an appointment with Penn State Health Obstetrics and Gynecology, scan the QR code right there on your screen. And as we've heard tonight, family matters, especially women's health. As grandmothers, mothers, and daughters, we need to take care of ourselves before we can take care of others.